Hello, my name's Faith Daggs. I'm an obstetrician gynecologist, the assistant medical director for Reply OBGYN and Fertility, and I'm here today to talk to you about men's fertility and male factor subfertility or infertility. We receive questions from patients regarding this, and it's absolutely paramount to address. No woman is fertile by herself. It's the only system in our body that is uniquely designed to maximize its function when two are involved. A woman needs a man to be fertile, and a man needs a woman to be fertile. And so our goal is to, as best we can, evaluate and optimize both sides of that equation to help a couple become a family. So to that end, we're gonna kind of get right into some of these questions that we've received regarding this. So first of all, what part of fertility or infertility is impacted by the male? Depending on who you read, generally we see about 30 to 40% of fertility disorder for the couple is related to the man. And actually on the counterpart of that, similarly for women, 30 to 40% is going to be on the female side, but then we're looking at that it's probably 20 to 30% together, because we know that you need to have both parts of the fertility equation together in order to be able to have both systems work at their optimum for conception. So the concern is then, what can be done? Is this a treatable disorder? Are there medical treatments? But even moreover, are there things that that man can do to optimize his fertility with his partner? And there certainly are. So from a nutritional perspective, this has been looked at recently, and we know that when both men and women are optimizing what they're getting in their bodies and even avoiding certain things, that's going to improve fertility. In particular, for men, there was a study that looked at the consumption of high sugar or high carbohydrate beverages like sodas or soft drinks or what we love here in the South, sweet tea. And actually those men who had higher consumption of those beverages had lower sperm counts. What the great thing we know about male fertility is that a man is pretty much fertile most of his life. But for a woman, she just has windows of fertility within her life, but even within each cycle of her menses, she's only fertile for about 6 days out of her cycle. But for a man, he's fertile every day. And he's always making new sperm. And those sperm are typically made about every 3 months. And so because of that, things that occur in both the short term and the long term can influence his reproductive health. The main way that we evaluate a man's fertility is by looking at what's called a semen analysis. The sperm within the seminal fluid, but also the properties of the sperm, how they swim, their degree of motility. Within that seminal fluid helps us understand the potential for that capacity and the likelihood of conception for that man with his partner. So that's a main way that we start the fertility evaluation for a man. There's several parameters within that we look at, and the good thing is we know that those parameters can be modified even when they appear abnormal, and then the results from that test can give us clues about where we need to look further in terms of a man's fertility. I mentioned diet before. We understand that in men who have a lot of trans fats in their diet, that can affect spermatogenesis and could even cause low sperm counts because of the inflammation it causes in the man's body and stop the sperm from developing. We know that the reverse is true. When he's getting the good kinds of fats in his diet, those omega fatty acids, EPA and DHA, that's that fish oil that your internist and your cardiologist has been telling you to take because it's good for your cardiovascular health, is also really good for your reproductive health. And that every parameter in a semen analysis was improved in a study where men were enriching their diet in these types of essential fatty acids. They're found in walnuts and fish. And in another study that just looked at couples, because we, if we're a couple, we're usually dining together. When couples together ate greater than 8 servings of fish in a cycle or in a month, so about 2 times a week, that increased their time to pregnancy, probably because it was improving the fertile parameters in the man and actually in the woman too. And even when they looked at certain diet types like the Mediterranean diet, that also seemed to improve the parameters for the men in their semen analysis, but even more looking towards live birth rates as well. So men can have a big impact on their fertility just in the way that they take care of themselves and the things that they put in their diet, and even in the things that they're doing as well. One challenge for men is understanding their role and their importance in fertility. And so because of that, we very much want both women and men to come for that initial subfertility evaluation and even the ongoing evaluations, because both are an important part in that couple and helping them to meet their goal of building their family with a natural pregnancy. With respect to when a man comes to the office, I'm going to ask him about all his health issues, health problems, exposures at work, exposures even in their yard. Are they using things like pesticides when they're treating the weeds in their yard, and how they could potentially affect their fertility, or are they exposed to chemicals in their workplace? All of those things that touch us in our lives can have potential effect on our fertility, both male and female. I mentioned that semen analysis as an important part of our evaluation, and that can sometimes point toward if there are problems for the male and his fertility, and if that's abnormal, where we need to explore further. This may involve treatments that we can apply and recommend to the man, sometimes in the form of certain nutritional supplements. We may recommend further evaluation with hormonal studies and be able to apply some treatments here. Oftentimes we work with our counterparts within male reproductive health. A reproductive urologist can be a very helpful partner as we're treating couples together to treat and manage fertility issues. One case in point would be after I had thoroughly kind of evaluated and treated a patient for the factors that were affecting her fertility. Even though, had met with and spoke with her spouse, he was kind of reticent to have some evaluation until we really knew what was going on with his wife. I kind of quoted him the same statistics, that there's often one part that's female and one part that's male, in order to encouraged him to pursue that evaluation. And when he did pursue that evaluation, we discovered that unfortunately his semen analysis was abnormal. But that being said, we got him to a reproductive urologist who performed an ultrasound and discovered he had a varicose vein, just a dilated blood vessel that was affecting his ability to make normal sperm because of elevating his body temperature. And he was able to have a procedure that restored and improved his fertility. And he and his wife were able to conceive within a couple months after that procedure, and went on a year later to have a baby girl. I specifically recall him coming up to me after their daughter was born and him saying, "It was about a year ago when I finally took your advice and had that test done." And in addition to it, allowing them to then conceive and have their daughter, he said it really allowed him to understand what his wife went through in a new way, and brought them even closer together when he had to go through evaluation and treatment. And that kind of was the bottom line, that this wasn't only helping them to achieve their goal of being parents, but really that they each better understood their fertility, better understood the other's fertility, and were able to come to greater health in the process as well. This is really our focus at Reply, to help couples achieve better health, better reproductive health, and then they're going to be in a better place to hopefully be parents for the children that will come next. If you're interested in learning more, please contact us at Reply OBGYN. You can contact us via our website at replyobgyn.com or call us at 919-230-2100 to schedule an appointment with one of our physicians or certified nurse midwives. We're looking forward to hearing from you.